How are you? I'm Dr. Gribble from the Vet on West Main, which is a part of the Vets of East Texas. I'm going to answer a few questions today about one of the most common problems that we have in veterinary medicine, and that is allergies. And we have a lot of good things to treat allergies. My assistant John Ed is going to be asking a few commonly asked questions about allergies, and I'm going to answer them today and hopefully give you some insight into why or why not your dog may be having some allergy problems.
Dr. Gribble, how common are allergies in dogs?
Well, I would say they're so common that I would venture to say that it is the most diagnosed problem we have in dogs in the country.
What are some common dog allergies?
So we live in Texas, and the top 3 dog allergies are fleas, fleas, and fleas. So when we can rule out fleas, we take care of a lot of allergies. So we have a lot of clients that come in, their dog is scratching, he's got hair loss over his tail and rump, and they don't understand why, and we take a look and there's some fleas, and they are very surprised when we say your dog has flea allergies, which could even be caused by one flea.
In addition to scratching, what other symptoms should I look for with allergies in my dog?
So scratching is by far the number one. Hair loss goes along with the scratching because a lot of times they're scratching their own hair out. But redness and swelling of the skin, so irritation. A lot of dogs with allergies will also have ear infections, red ears, and we call it helicoptering because they start shaking their head and their ears are flopping around. That's a very good signal that your dog may have an ear infection going on, and that ear infection could have started out as an allergy problem.
Dr. Gribble, how will a veterinarian test my dog for allergies?
Most of it's going to be with physical exam. There are some allergies that we can't quite be sure of, so we do allergy testing. Used to be very similar to skin testing in humans. They put some allergens under the skin and see how the dog reacts. Now we have a much simpler test, which we can just draw blood, send it in, and we get a list of things that your dog is allergic to. So if we can't tell right away, or we've ruled out the most common causes, and we need to look for something, what we call a zebra, we have to go look for the zebra, then we may have to send your dog's blood in to determine actually what they are allergic to. But I do have a lot of clients who for some reason may think, well, my dog is allergic to this, something they found on the internet. They say, my dog is allergic to this. And a lot of times, maybe not so much, but we can find definitive answers with a physical exam. And if that doesn't work, ruling out the most common things. And if that doesn't work, send them blood in and get an exact list of your dog's allergens.
If I have to do the allergy testing, about how long does a typical time for results to come back?
So we usually have results within a week. We send those blood samples in and we'll have a list of allergens within a week.
What are common treatments for dogs with allergies?
So we got some great things now to treat dog allergies with. And I'll start out with the one that is of zero help to your itchy dog, and that is any over-the-counter antihistamine is not helping your dog. It may be making your dog drowsy, and when they are sleepy, they don't scratch as much, but it is not reducing the itch. Studies show less than 15% of dogs will even have that drowsy effect. So a waste of money if you want to try something anti-itch, like an antihistamine, not going to help your dog. We've got things that are way safer than what we used to have. So 7 years ago, a drug called Cytopoint came out, which is an injection. It's a monoclonal antibody. It works only on itch. The most recent study into the effectiveness of Cytopoint, used an itch scale, and they asked the owners, what's your itch scale, 1 to 10? So these dogs had to be 7, 8, 9, 10 to be in the study. 50% reduction in that itch scale was considered success. And with this Cytopoint injection, the monoclonal antibody, 100% of the dogs that got it had reduced their itch scale by 50% in 2 months.
Is there anything I need to do differently in my home environment for my dog's allergies?
So flea prevention is the first thing we recommend here in Texas. And anywhere in the South, anywhere fleas are going to multiply very rapidly, where the temperature is above 80 degrees for more than 21 days in a row, you're going to have a lot of fleas. So fleas is number one. Now, we find that some dogs may be allergic to carpet cleaning powders that you use, other things that you use to clean your floor, but those are rare cases. They do exist, but they are not on the top of the most common causes of itch in dogs.
And my last question, how are allergies in dogs different from allergies in humans?
So how are they different? They are very similar. The same molecule called interleukin 31 has itch properties in humans as well. And there are monoclonal antibodies for that disease in humans as well. Now, humans will respond more to an antihistamine than a dog will. So you might see some more benefit with that antihistamine, and in your mind think, I'm going to get some benefit on my dog too. You are not. So Cytopoint we talked about. Another drug called Apoquel, it's been out about 10 years now, does a great job on itching. The only problem with that is they have to get it every single day, and if they miss a day, then they're going to spend that entire day itching. Cytopoint, the injection that we talk about, lasts for 8 weeks. In many dogs, the label says between 4 and 8 weeks. So we get one shot and you don't have to worry about it for a month, sometimes 2 months. So we encourage that injection, that way you're not having to give your dog a medication orally every day. Now, not worst case scenario, but when we've run out of options and nothing is helping these dogs scratch less, then we're left with corticosteroids. And corticosteroids are effective against itch, but they have a list of long-term side effects that we do not want to use in a dog. Now, if your dog is 20 years old and the only thing that stops him from scratching is corticosteroids, then as a veterinarian, I'm thinking we're not really that worried about long-term benefits. But any dog, and most of the dogs we see are young enough that we want to stay away from corticosteroids. If you're going to a veterinarian's office and they're pumping corticosteroids into your dog, find another veterinarian. So if you have any questions about the medications that we talked about, the symptoms that you might see with your dog scratching, and what we can do in our practice to help your dog scratching, give us a call. Our number is easy to find, and you're on our website right now, so you know where our contact is. Thank you very much. I'm Dr. Gribble.